What I enjoy most about my work is being able to make a difference within the community, connecting with my clients and being more than just a community health worker, but also a friend and a helping hand is definitely something that's very fulfilling for me. And that's what I enjoy most about this role.
When I contact them, I don't feel rushed at this job. I feel like I can really take the time to get to know what's happening with them and be able to provide resources for them and in a relaxed environment.
I'm there to listen and, being able to hear that smile over the phone and hear that I'm making an impact in their life is very rewarding.
Challenges or barriers that my clients encounter are not only the chronic illnesses or physical health barriers that they have, but also inadequate resources that they might not know are in the community or are available to them. So that can include transportation to and from their healthcare provider, access to meals, other inadequate resources, like I said, that they aren't aware of. That is when the community health worker steps in to provide those resources, to provide guidance in order for them to live more fulfilling lives, to keep them safe in their home and out of facility-based care.
So some barriers that I notice that my clients face are not being educated enough about their diagnosis and why things are happening to them, not having enough resources available that they don't know about. I find those kind of I notice challenges on that with them.
We do have discharge plans, usually for some of them. So when they come home, we want to make sure that we have everything set up for them. So if there's a change, like a rollator, or now they may need a wheelchair or whatever it takes for them to stay in the home is a part of what the community health workers are able to help with.
I apply person-centered planning within my work by identifying the client's goals, connecting with them on a more personal level.
I usually like to listen to the client and what's important to them. Maybe setting goals for themselves, involving their family, maybe close friends to help achieve those goals.
I have a client who's facing several chronic illnesses and changes in their health, and that client has also had mental health struggles because of that. And we've identified ways for them to be able to be more involved within their community, find hobbies, and that's directly impacted their mental health, which I do believe has impacted their physical health as well.
Helping to educate them on how going to the doctor regularly can help with preventative care. It can be a challenge at times. However, it's a very important component for them to be able to stay healthy.
One thing that I've learned is all the resources out there. So for instance, those mobile doctors, those food pantries. I work with lots of clients that have like an Advantage program or health plan, and they offer perks. So one perk is a healthy foods card with an over-the-counter benefit card, and that helps, with utilities and food, which I thought was very surprising.
I was unaware of so many resources before starting this role, and it's really just opened up a whole new world for enriching my clients' lives, but also just having that knowledge for anyone who might possibly be in need of those resources too. At the end of the day, I think my work is making a difference. I can tell by the cheerfulness on the phone between my clients. Oftentimes when I'm meeting them, they are in a tough spot, either physically, mentally. They're in the hospital, they're in a nursing facility, rehabilitation, and by the time we are ending our journey, they are physically stronger and also mentally stronger as well.
Well, I have a passion a little bit differently because I've gone through my own health issues, not knowing how to navigate not knowing how to ask for help, not knowing how to say, I don't think this medication is working right for me. I also lost my parents. My parents are both deceased.
I feel like it's making a difference because I'm able to, be that support system for the client, help, with care coordination, and helping set goals that they feel like they can achieve.
I feel that it's personal for me. Every person is my mom and dad. Every person is my grandparent. Every person is my aging aunt. And so I look at them and want to serve them as if I would serve my own family or want to be served myself.